Hi, my name is Yalda Jabbarpour, and I'm Georgetown Class of Medicine 2008. Georgetown to me means home, intellectually, professionally, and personally. My path to medicine did not begin in Washington, D.C. I grew up in Southern California, and I attended undergrad at UCLA. After undergrad, I worked as a fourth grade teacher on the south side of Chicago with Teach for America. I was also first generation to grow up in the United States in my family, and my mom worked as a nurse, which really was my introduction to medicine, both from watching my mom and hearing her stories about her patients, but also watching my students and their families on the south side of Chicago navigate the healthcare system. I started to realize that health was much more than just a diagnosis. It really was about people, their families, their communities, and the circumstances they find themselves in. And when I got to Georgetown, I realized that that concept had a name, Cura Personalis, or care of the whole person. At Georgetown, Cura Personalis was not just a slogan, it really permeated how we were taught, both inside the classroom and inside the clinic. We were taught to listen to the patient and care for them in the context of their families, communities, and the circumstances they found themselves in. For me, I really found that this concept was embodied in my family medicine rotation, where I saw doctors caring for entire families at once in the clinic and caring for those families throughout their lifespan. And then at the end of the day, they would hang up their white coats and go out into the community and serve as public health officials on their city councils, on their school boards, and really be leaders in their communities advocating for patients, not only when they were in clinic, but also in the jobs that they did outside of clinic. And that really drew me to family medicine as a profession. Today, I am a family medicine doctor. I continue to work at Georgetown and give back by precepting students and residents, but I am also director and vice president of the Robert Graham Center for Policy Studies in Primary Care. The center focuses on strengthening primary care through research with the goal of informing policy that improves health equity, access, and outcomes for communities across the country. Leading the center really feels like a natural extension of what Georgetown taught me to think broadly, act purposefully, and always keep people at the center of our work. Probably most importantly for me, though, Georgetown means family. It's where I met some of my closest friends and colleagues that I continue to work with to this day. I also met my husband there in gross anatomy lab, of all places, and it's where we began building our life together. And without Georgetown, none of this would be possible. Georgetown believed in caring for the whole person long before it became a popular phrase. And for me, it has meant purpose, belonging, and home then and now.